everyone. Thank you for joining today's webinar. We're going to go ahead and get started here so we can make the best use of everybody's time. So my name is Jennifer Whitener, and I am the Benefits Manager here for Larimer County. So today we are here to talk specifically about our High Deductible Health Plan that we are offering to employees here in 2026. So this presentation is solely just covering our High Deductible Health Plan and the resources available to you as a High Deductible Health Plan member. Just a little bit of housekeeping. We will be doing webinars once a week, each week this month, and we'll be alternating. So for anyone who's enrolled on the Surest Medical Plan this year, we'll be doing 2 webinars to go over that plan and its resources. So we'll be doing the first one of those next week. And so this will be recorded for those who aren't able to attend, and we'll make sure to post that out on our benefits website so then anybody can access it at a time that's convenient for them. This is a recorded presentation, so as such, you're not able to unmute your microphone, but you are certainly welcome to drop questions in the chat. So feel free to do so. Rachel Sporletter and Lauren Emery from our benefits team will be helping address those questions here for you today. And feel free to drop those in at any time, and then we'll do a recap of any and all questions at the end of the presentation as well. All right, so let's start talking about high deductible health plans. It's really interesting because high deductible health plans, they have now been around for over 20 years. So these started back in 2004 is when they were actually introduced into the market. And so they've been around now for a little bit. But it can still be new for someone who might not have ever been on a high deductible health plan before. So we really want to spend a little bit of time today talking about how the plan works, just some general knowledge and how it's different from a traditional PPO sort of medical plan. We're going to talk about the health savings account that goes with your high deductible health plan. And we're going to talk about some great resources here like the Wellness Clinic, UHC network discounts, your prescription coverage, and then just some additional resources you might want to be thinking about, as well as just a quick walkthrough of our UMR member portal. And like I said, at the end, we'll have time for Q&A if you think of anything throughout the presentation. So with that, we'll go ahead and move forward. So this plan is pretty simple when you think about it, because it truly is a deductible only plan. So we've listed what those in-network deductible amounts are here. So that's going to be for the course of the calendar year 2026. It's $3,400 if you have single coverage, and then it's $6,800 if you have anything besides single coverage, if you cover your spouse, children, etc. Something I do like to point out is that this is an embedded deductible. So there's 2 different types of deductible structures you can offer under a high deductible health plan. Some employers offer what's called an aggregate deductible, and the option we offer is different. It's called an embedded deductible. And that's because it's what you're used to from a traditional PPO medical plan. So just like for those who are on the Surest plan, when you have family coverage, one person in your family needs to meet that individual deductible amount of $3,400 for the year. And then a combination of the other family members, it could be one or multiple people, have to meet another $3,400 in out-of-pocket costs before you would be considered as meeting that $6,800 amount for the whole family. And as I mentioned, this is a deductible only plan. So once you've met that deductible for the year, in this example, looking at in-network covered services, the rest of your expenses for the year are going to be covered at 100%. So that's why we've got listed below those same amounts for your out-of-pocket maximum, because it's truly for single coverage, once you've paid $3,400, that's it. Then claims start paying at 100%. And then for family, it's that $6,800 amount. So there's no co-pays, no co-insurance on this plan. You're just paying the full cost for any service you receive until you meet that deductible for the year. So let's look at some more examples. So in this example, Sandy is 48 years old and she's worked for the county for 10 years. Her and her husband have 2 children, so she selected the family plan and the high deductible health plan. So Sandy goes in for her annual preventive exam. Let's just say it's her well woman exam. They do a pap smear. This is going to be paid for by the plan at 100% because it's a visit that's qualifying as a preventive care service. So that's not going to cost Sandy a penny. Let's say Sandy's husband comes down with the flu. It's flu season right now. It's pretty gnarly. But he knows, being covered under Sandy's plan, that they have access to Teladoc. And it is free to use Teladoc. So he uses it to talk to a doctor, even though it's late at night, because Teladoc is a 24/7 service that gives you access to certified physicians in the state of Colorado or whatever state you're in to receive that acute care service. And if it's determined that a prescription is even needed related to your issue, they're able to prescribe that for you and send it into your close pharmacy. So that's a great benefit that's offered under this plan. So Teladoc is no cost. Another example here, let's say Sandy has a child who gets a bad cut. So she's going to take that child to an in-network urgent care center to get treatment. The claim is run through insurance. And if the total bill for that urgent care appointment is $138, she's going to pay that full $138 because that's the total amount of the claim after it's been run through insurance. And they had not met their deductible yet. Now, Sandy also has family coverage under the voluntary accident plan through Voya. So going back to that child's urgent care visit, that's a claim under the accident plan. So she files a claim to be reimbursed for that urgent care visit, and she's actually going to be reimbursed. It's a flat dollar amount, regardless of where they go or how much that bill ends up being. So for an urgent care visit, it's a flat reimbursement amount of $250 for that visit. And then they actually provide another reimbursement amount back for stitches. So making sure to remember, if you do end up you or anyone in your family having any sort of accidents throughout the course of the year that requires you to go to the doctor, to urgent care, to the ER, that's a claim that can be filed under that accident plan through Voya to help reimburse yourself back some of the out-of-pocket expenses you're incurring. Something else that's very common is that, folks are going to be on medications when you're on this plan. And so just like medical services, anytime you have a prescription filled, you're going to pay the full cost for that prescription until you meet your deductible for the year. So, in this case, she was taking a brand name prescription, Lipitor. The doctor prescribed that brand name version, but you can actually ask your provider to prescribe a generic version instead, because those typically tend to be low cost or even no cost in certain circumstances. So let's do another example here. Sandy's husband has a large claim and meets his individual deductible of $3,400. Now, any covered in-network claim he has the rest of the year, that's going to be covered at 100%. Now, between Sandy and her two children, they in total must meet that other $3,400 deductible amount in order for their claims to be covered at 100%. So again, that's going to be an example of how that embedded deductible works on this plan. So similar thing for massage and acupuncture claims. So again, if you are someone who likes to get those routine massage or acupuncture therapy appointments, you are paying the full cost for those appointments until you meet your deductible. And this plan has, I've been focusing on the in network deductible amounts, but this plan has a separate deductible for out of network providers. So those massage and acupuncture claims are going to more than likely apply to the out of network deductible amount rather than the in network deductible amount. And those in-network and out-of-network amounts, they don't count towards each other. They don't cross accumulate is what that's called. So that's just something to be aware of. In addition, if you are receiving a massage or acupuncture therapy visit, that is something that's eligible that you can use your HSA to pay for as long as you have a letter of medical necessity from a doctor stating that it's required as part of your course of treatment for whatever condition you might be having. Preventive exams. So, again, the Affordable Care Act gave us a very clear list of preventive care services that are to be covered at 100%. And that list continues to be managed and maintained by the CDC at this time. And so, based upon that guidance and what's covered as preventive, that's going to include services such as mammograms, colonoscopies, and immunizations. And again, it's going to follow the recommended age guidelines for those services in order for them to be covered at 100%. An issue that we do have come up often on this plan is, well, what if I have to go in for a diagnostic mammogram? Say last year, they found a lump, and so now that's considered a diagnostic mammogram this year that they're following up on. Is that going to be covered at 100%? Unfortunately, the answer is no, it would not. So if a mammogram or a colonoscopy is being billed as a diagnostic claim on this plan, it will not be covered at 100%. It truly does have to be coded and submitted as a preventive claim in order for that to be covered at 100%. So if you don't have any sort of medical history and they haven't found something recently in the past that they're following up on, and you're just going in for your routine every 5-year exam, for example, then that would be covered at 100%. So that's very different from the Surest plan and from our previous standard and choice plans that I just want to highlight and call out because it is different. So when the high deductible health plans were established back in 2004, that's also when health savings accounts were established. And so we use a third party vendor for that service called Surancy. And a health savings account is an account where money is being contributed pre tax into this individual bank account that's established on your behalf, where that money can earn interest tax free. And then, as long as you're using that money for eligible distributions like medical, dental, and vision expenses, that also includes over the counter medications, feminine hygiene products. So, there are a lot of things that this can be used for. So that distribution, as long as it's for an eligible expense, is also tax-free. So you'll hear it referred to as having that triple tax savings advantage quite often. So, as an employer, we have decided to contribute into a health savings account on your behalf if you're enrolled on the High Deductible Health Plan, because HSAs are only allowed to be paired with those who are enrolled in a qualified high deductible health plan like ours. So, the reason we'd put a contribution in, especially if you're someone new to this type of plan, is that it can be hard if you have a big medical expense up front at the beginning of the year to be able to establish any sort of balance in that HSA account because you do have to save that money up over time. So, as an employer, we've decided to help you build that balance by contributing into the health savings account on your behalf. So this is deposited equally over a 24 pay period. So it's always going to be the first two paychecks of the year or of the month. And you'll see annually what those amounts are in this middle column. So, for example, employee only coverage. Over the course of the year, the county is going to put $1,000 into that account on your behalf. And then we've shown what that amount equates to on a per paycheck basis. Now, you are not required to contribute into that HSA to receive the employer contribution. So that is optional. But if you would like to do so, you certainly can. What's also nice about the HSA is that it's a bit more flexible. So if you have decided to make a contribution, but you want to change it at any time during the year, you are allowed to do so without any sort of qualifying life event. You can also, if you want to do just like a very large lump sum contribution into your account at any point in time, you are welcome to do that as well. You would just want to contact and reach out to the benefits team, and we can talk you through that process. And what's nice about the HSA, another highlight that we like to bring forward is that this is not a use it or lose it account. This balance will roll over the full balance year after year, regardless of the election. So if you have $1,000 balance at the end of the year, it's just going to roll over into the next calendar year. So it's really nice. I mean, that's why it is called a savings account. The intent is that you're saving and putting this money aside to use for health expenses in the future. And so that's a really great feature that this offers. So as I mentioned, Surancy is our plan administrator for the health savings account. So you can file claims via the Surancy app or on the employee portal online, which we've got the address listed here. I highly recommend downloading the app. It's very user-friendly. You're able to go in and track and manage your expenses over time. You have access to your tax documents there, which is really great. And you have the ability to reimburse yourself back in the event you need to, just right through the app as well. So it's very easy and quick to download, and definitely want to make sure we call that out. If you aren't sure if something you want to use your HSA for qualifies, a great resource for that is hsastore.com. And there's a full eligibility list you can refer to there if you're not sure if a certain service or item would qualify. And as I mentioned, this account does allow you to earn interest tax-free. When that balance reaches over $1,000, you actually have the option to make adjustments to the investment account that you want to have your funds in. And so that's also a nice feature to try to maximize the value of that account. So the IRS does set annual limits in terms of how much we can put into our HSAs each year. So I've listed those amounts here for you. And please note that that limit must include any employer contribution that goes into that account as well. So for single coverage, that amount is $4,400, and for family coverage, it's $8,750. They do offer a catch-up provision if you are over age 55, so you are allowed to contribute an additional $1,000 to put into your HSA if you are over age 55. So because this plan is, very much focused on the fact that you're paying for everything up front until you meet your deductible, I wanted to highlight some different resources here to try to help stretch those dollars further for you, that have been really helpful in terms of saving money over time when you're on this type of plan. So, if this is a new plan for you, I think that's really the big takeaway for today is that this is an opportunity for you to look at options and evaluate, different providers or different services, because doing cost comparisons and kind of shopping around, if you will, just helps you stretch those dollars further on this plan. So, a great resource that I'm sure most of you know about is our wellness clinic, but I always like to highlight this just in case. So our wellness clinic's located at 2601 Midpoint Drive over at our Midpoint Drive campus. And we have some fantastic providers there that can do a wide array of services there. That's going to be much more cost effective than going out to a Banner or a UC Health clinic out in the community. So they are able to provide services such as preventive exams. They can even actually do well woman exams there. So that's something that a lot of folks don't know, is that if you're due for a pap smear, for example, that's actually a service that can be provided through our wellness clinic. They also perform biometric screenings. So any sort of lab work that you might need done, they're able to perform that there. And they offer both venipuncture and finger stick options for draw. Immunizations. So I always recommend call and check ahead of time to make sure that if it's an immunization you want, that it's something they have on stock there, because there are a few immunizations that they don't keep in-house. For example, they don't keep COVID vaccines there just because of the limited time frame that you have to keep those in storage compared to the cost. It just didn't make sense for those to be provided through the clinic. So yes, immunizations are offered, but always just call and check first to make sure they've got it. They also offer registered dietitian services there, which is great. I just met with her last month. We did a complete review, for example, of all the vitamins and supplements that I was taking. Just did a full review of diet and what could be adjusted or supplemented in, and it's just a really great, valuable service that we offer there. So they can help with meal planning and things like that. We offer physical therapy at the wellness clinic. So Andy does a fantastic job. He's our full-time physical therapist out there. And again, that's a service that we'll continue to provide through the wellness clinic. So any of these any of these things I've mentioned above, for example, the registered dietitian visit or the physical therapy visit, it would be a $45 service fee for that visit because it's not a preventive care exam. But if you are going there truly just for a preventive exam or service, those will be covered at 100%. So for example, if I'm going in for a flu shot, well, a flu shot is a preventive immunization that would qualify to be covered at 100%. So if I'm truly just going to the wellness clinic to get a flu shot, then that will be no cost to me to do that. The other nice thing about the wellness clinic, just another reminder if you aren't aware, is that you're able to use clinic leave for when you have an appointment at the wellness clinic. So it's its own separate bucket of leave time that you can use for that. So you don't have to code or take away from your sick time bank when you have an appointment at the wellness clinic, you would use clinic leave instead for that. So that's just another nice feature we like to highlight. Another feature here, just our United Healthcare Network discounts. So, as a reminder, network discounts still apply here. So that's a really common question that we get over time is, so I'm just paying the full cost for this? And the answer is no, because there is still a United Healthcare Network discount that's being applied to your claim. So, for example, you have a service that's billed for $200, say it's an office visit. If that provider tries to bill you for that full $200 and they haven't submitted that claim to UMR yet to have the discount applied, you should not be paying that claim. You always want to push back and make sure they understand that, hey, I'm on a high deductible health plan. I would like you to run this through insurance first so that I can get my insurance discount before I pay this bill. So that's just something I try to emphasize and remind staff that, you do still get a network discount on this plan. And we utilize the United Healthcare Choice Plus network, which is a nationwide network. And this plan does have what we call open network benefits for emergency room and urgent care. So, what that means is if you go to an out of network urgent care office or an out of network emergency room, that claim is still going to process and be covered under your in network deductible. So it's not going to process as an out-of-network claim. It will process as an in-network claim, even if that particular ER or urgent care office is not in the United Healthcare Choice Plus network. All right, so prescription coverage. I highlighted this a little bit earlier in our example with Sandy and her family, but just want to go through this one more time. So our prescription benefits, they're administered through CVS Caremark. As I mentioned, you're going to pay the full cost for those prescriptions until the deductible is met. There is a $0 preventive drug list that CVS offers that allows us to receive. There are truly hundreds of drugs on this list that you can get for no cost, which is great. And you also have the ability to shop around for the cheapest pharmacy on the CVS Caremark member site. Some other options that I just like to make sure folks are aware of is that sometimes drug manufacturers will offer discounts or coupons through the websites I've listed here. GoodRx.com. Another popular site is costplusdrugs.com. And depending on the medication you're having filled, sometimes you can actually get a better deal and pay less out of pocket for that drug when you use, a coupon or have a drug filled through these sites versus going to your traditional King Soopers pharmacy, for example. So that's just another thing to be thinking about in terms of prescription medications, because sometimes they can be very expensive. And so it's good to know that there's these additional resources out there that could help reduce your out of pocket cost for those medications. So, as I mentioned on the Caremark member portal, they have this prescription drug pricing tool. So, once you've registered your account with CVS Caremark, you'll see here right on your home screen, there's the ability to click on this icon here, price a drug. And then you would just enter the drug name and then the dosage and your zip code to search for the cheapest pricing in your area if you're going to do that through a traditional pharmacy. So, some additional resources to, again, just really stretch those dollars when you're on a high deductible health plan. The first that I want to highlight is Second MD. And this is a really fantastic resource that I can't highlight enough because it is a free second opinion resource that you can use um, when you've been diagnosed with a condition and your provider has given you a recommended course of treatment, or maybe they've requested that you have a surgery scheduled. Um, Second MD gives you access to some of the best physicians in their specialty areas across the country, including providers from the Mayo Clinic, from MD Anderson in Texas. They are just top notch providers who will collect your medical records on your behalf and then do consults with you to have discussions around maybe you have questions with your lab results and what your doctor's recommending for next steps. Um, and they are able to really just spend time with you and answer questions that you may have. You can have an hour-long consult where you can just talk to a doctor directly without feeling rushed, without having to feel the pressure that they're just trying to get you through as quickly as possible. These folks take their time and they really do care about knowing you as a whole patient and your medical history and story to help either maybe ease concerns you have or maybe provide alternate recommendations in terms of your course of treatment going forward. So I've used this service multiple times because it's free. And, to have a whole hour with a doctor outside of this service could be very expensive, first of all, but also just hard to get into to see a doctor for that long of a time. Because with Second MD, usually you're able to get an appointment with your provider within a couple of weeks, just as soon as they get those medical records collected. So it's a great service. I highly, highly recommend. And for anyone who does a consult with a physician through Second MD, you actually get a $100 reward for completing that first consultation during the course of the year. And it's just emailed to you. It's an electronic gift card. So it's super fast and easy to use. So if it's not something you've thought about using in the past, I highly recommend checking that out. An example, just if you're not sure, what can I use this for? I had, done my annual mammogram and they found something on the test result and recommended a next course of treatment in terms of follow-up imaging or surgery. And so I sent that into Second MD and said, hey, can you collect my records? I'd like to get another opinion on that. And really within a week, I was able to get in touch with a provider, again, top notch in their field. They had all of the imaging with them and that they shared with me and we looked at together online. They were able to help ease concerns and provide their insight in terms of what their recommended next steps were. And it was a huge relief just to have that information provided, more than I had ever received directly from the doctor I had gone to. And again, that was no cost. So if you would like more information on that service, please reach out to the benefits team and we're happy to share that with you. And we've got it listed on our benefits site as well. Teladoc. So Teladoc, it is an app you would download on your phone, and it's free to use on this plan. So Teladoc offers a variety of services, general acute care. So the most common thing I can think of is maybe it's a Saturday night and you've got a sinus infection and you need a Z-Pak to get you feeling better. That's a really common thing that they're used for. You can just dial them up, request a consult with a provider. If they agree with you based on your symptoms that, medication is required to treat your condition, they'll call it in right away. And it's no cost for you to do that. You don't have to go to an urgent care where you're going to be around a bunch of other sick people and get exposed potentially. You can do it from the convenience of anywhere, whether you're at home or maybe if you're traveling or on vacation. It really is a very convenient service. They also offer behavioral health counseling. So it works just as traditional behavioral health counseling would work. It's just that the physician you select, you're going to just meet with them virtually, like you would using FaceTime for that appointment. But it's just all done through their app. And you'll establish the cadence in terms of how often you would visit with that provider. But again, that's going to be no cost for you to access and use that service. And then they also offer dermatology consultations through Teladoc as well. So another just great resource, again, to try to stretch your plan dollars on the high deductible plan. And the other benefit I highlighted, the Voya accident plan. There is just a flat schedule of payouts that can be made directly to you when you or family members have accidents. And even if you don't have any accidents over the course of the year, there is a $75 wellness screening benefit that they will pay you and anyone covered on your plan once per year. And that can be for doing something as simple as your annual biometric screening, or for kids if they have their annual sports physical. Those are the sorts of things that would qualify in order for you to apply for and get that $75 wellness benefit from Voya. So just lots of great resources out there that we want to make sure as a high deductible health plan member that you're aware of. Now, if you haven't registered already, I highly, highly, highly recommend that you do go ahead and register and create an account on the UMR member portal. So I've listed the address here. It's very simple. It's umr.com. And I will show you the highlights of the website here in a minute. But you can see this is a great resource for you because you can get your ID card if you've lost it and you need a digital copy of your ID card, or if you need to request a new copy be sent to you. It's right here on the member portal. You can look at your claims history, and all of your explanations of benefits are going to be on here. And there's also a cost comparison tool that you can use if you are going to be needing to have any sort of high cost procedure done, any sort of surgery done. There's a cost estimator tool out on this website that you can access and use as well. So if anything you take away from today, make sure that you go out and register and create your member account on the portal at umr.com. So I've listed our contact information here for questions you might have. And you can contact us Monday through Friday. So our benefits team, the fastest way to get in touch with us and get a response is when you send something out to just our general inbox, because we always have someone monitoring and responding to those inquiries. And then I also have listed the UMR customer service information here for you too. They're also available Monday through Friday, and their availability is a little bit better. It's 7 to 7. So before we go into any Q&A, I did just want to highlight those different websites here for you to make sure you knew where they were. So we have our Surancy site listed here. It's just surancy.com. And then we have a dedicated site for Larimer County. So it's this surancy.com/company/Larimer-co. And so this is a great place for you to start. You can start, if you haven't created a Surancy account, this is where you can go and select an account to start that process and get registered. But I really like the app. I'm just going to say I feel like the app is a little bit more user-friendly, but you have an online website portal option for you as well if you would like to use that versus an app. Next, as I mentioned, that UMR portal, just umr.com. So when you're going to create an account for the first time, you're actually just going to click on the sign in icon on the right-hand side of the screen. And then when you do that, it's going to say right here, if you need to register, you'll click on create your account. And then from there, you would say, well, I'm a member. And then it's going to start to walk you through that registration process. So it's going to refer to something as a health safe ID. And so that's just an extra layer of security that UMR has in order for you to access this portal, because it is containing PHI, protected health information. So you'll see here the information they're going to request to help you create that health safe ID. And so it's very basic information. It's going to be your first name, last name, your date of birth. And then you can either enter in the member ID from your ID card here, or you can select Social Security number and enter that instead if you would like to do so. And then again, it is going to ask for that group number. So that was also something you would get from your ID card. And then you would hit continue and it'll take you through the prompts. So once you've completed that, it's going to take you to the member page itself, like in the slide example that I showed you, so that you can access information there. If you need to submit a claim online, like if you go and get a massage claim, that's going to be your spot to go and submit that electronically as well. And so it's just a really great resource that you'll want to have access to. There's also a separate login you can use and create if you want to use Marathon Health. So if you want to go to the wellness clinic, remember that's managed through Marathon Health, and that's where we would go for that. So it's just my.marathonhealth.com/login for that. As I mentioned, we also have Cost Plus Drugs, which is a third-party vendor where you potentially could shop around for particular medications at a lower cost than what you can get through the traditional pharmacy. So that's something we just like to highlight, as well as goodrx.com. So these are both websites where you can shop around for medications and see how you could get that at the lowest cost possible. So lots of resources out there. And at any point in time, if you want help in terms of where do I go for this, or can you help walk me through that again, please reach out to our benefits team. We are happy to meet with you and walk you through that at any time. So we're here. If you ever have questions about claims and you want to make sure that a claim processed correctly, for example, just give us a call, shoot us an email. That's what we're here to do, is to help you and to help you maximize your benefits on this high deductible health plan. So I want to thank you all. That's all I have for the presentation itself today. So I'm going to turn it over to Rachel and Lauren to see what questions we've had come up in the chat. So Rachel, you want to go first?
I sure will. I only got 2 questions in the chat. One was regarding Teladoc. So just as Jennifer confirmed, I know last year for HDHP members, Teladoc was not covered at 100%, but it is starting 1/1/26. Myself, I don't know if Jennifer had this, but I actually had to delete my Teladoc app and re-download it. So if you're getting a message regarding your plan has been discontinued or anything like that, I recommend just delete the app, re-download it, and then log in, answer all of the medical health history questions now. Then when you need an actual, when you do have an emergency, you don't have to go through all of those questions at that point. Two other things that I was going to point out quickly on Surancy. Jennifer, I just didn't want to interrupt you. But on that app for Surancy, they actually have a scanning tool so that if you're at the store shopping and you're unsure if something is eligible, you can scan the UPC code and it will tell you if it's eligible or not. So really cool. Another kind of bonus for the app. One other thing is I know this year we saw an influx of people moving from an FSA into an HSA. Since that is the same provider, if you have an old quote unquote FSA card, that will still be your card under the HSA. Until those cards expire, you will use those cards under both plans. Looks like I have a question that came in. If we have a manufacturer coupon to help pay for an RX, does it count towards our high deductible or is that not run through insurance? Jennifer, you want to take that one?
Yeah, so it would still apply towards insurance in terms of whatever you pay out of pocket. So if that manufacturer coupon, saves you money so that you only have to pay $10 for that medication, then that $10 will apply towards your in-network deductible to say, well, you paid $10 out of pocket, so that's going towards the bucket. But anything that the coupon covers would not go towards your deductible. So great question.
That's all I have. Lauren, did you have anything?
I had no questions in the chat.
Great.
Wonderful. Well, I really just want to thank you guys for joining today. You are going to get awarded 20 Nectar points for attending today's presentation. So we really appreciate and thank you for that. Our employees have the best questions and you're so engaged in your benefits and we really appreciate that. So thank you. Please recommend this to your friends. Like I said, next week we'll be doing a Surest webinar and then the week after that we'll do another high deductible one. So we're alternating back and forth each week. And again, we'll post the recorded version out on the HR site. So you've got access to that as well if needed. I'll just take another quick look. I don't see any other questions in the chat. So with that, we'll go ahead and end today's presentation. So thanks again, everyone, and have a great rest of your week. Bye-bye now.